So, today we are going to start with a new chapter. But what the chapter is, we are going to see now. So, what do you think? What would be our chapter today? So, our chapter is the endocrine system. Now, if we talk about the endocrine system, first we need to know that why do we call this system the endocrine system? Why not any other systems? Like every system has its name because of its significance, because of some reason that we are going to see today. First, we'll see what are hormones. Hormones are basically the word which is derived from the Greek word horma, meaning to stir up or speed up. The substances secreted by ductless glands, which coordinates the activities of living organisms, are known as the hormones. These hormones are produced in ductless glands. Remember it, ductless glands. Follows, sorry, Flows through the bloodstream directly. These are known as the chemical coordinators, or these are the chemical coordinators. Now the endocrine system. Why do we call it the endocrine system? We are going to now know it. So endocrine system consists of endocrine glands which brings about chemical coordination in the body. What does endo mean? Endo means inside, crine means separate. So inside separate. So total meaning secreting the hormones or secreting any of the chemical coordinations internally. So these endocrine system are having the ductless glands because the secretions are poured directly to the bloodstream. So as you can see it here, let me use the pen once. Yeah. So as you can see it here, so here, see here, these are the vesicles, these are the endocrine tissues, these are the blood. So directly to the blood they are pouring it. So that is why they are known as the endocrine gland, and this system is known as endocrine system. Now we are going to know about the properties of hormones. So these are secreted directly to the bloodstream. It regulates the psychological behaviors, okay, sorry, physiological behaviors as well as the psychological behaviors, affects organs far from their source gland. Similar influence in other species, produced in very small amount but biologically active. They may be in the form of peptides, which are proteins like insulin, which is soluble in water, amines like amino acids, which is like adrenaline, and the steroids or cholesterol type like the testosterone. Excess of deficiency of secretion leads to serious problems. Not stored in body, and it is secreted from the system directly. Now here are some of the endocrine glands that we are going to study today. So mainly we are having the main 7 glands: the adrenal glands or the adrenal glands, the pancreas gland, the thyroid gland, the pituitary gland, the parathyroid gland, the thymus gland, and the gonads. Now today we are going to learn about the first four, that is the adrenal, pancreas, thyroid, and pituitary. First we are having the adrenal gland. So these glands are present on top of the kidney like a cap. So as you can see in the picture on the right hand side, so there you can see that one cap like substance is there, one cap like structure is there on top of the kidneys, which is known as the adrenal gland. It is labeled there too. Each gland has two parts, the medulla and the cortex. Beside that picture you can see one more picture which is showing the medulla, cortex, and the capsule. Okay, these are the parts. The glands are having two parts, mainly the medulla and the cortex. Now the hormone secreted by the adrenal medulla, it secretes adrenaline. Adrenaline. It is also known as epinephrine or noradrenaline. What is known as? It is known as epinephrine or noradrenaline. It prepares the body for 3 F's. What are they? The fear, fight, or flight. Means this adrenal gland is associated with your fear, or it is secreting the hormones when you are in fear or you are frightened. You want to fight, means you want to face the obstacle. That time adrenal gland is there, means when you are angry, and flight, or you are thinking to go away from here, you are having the palpitations to go away from the situation. So in these three cases of fear, fight, and flight, this adrenal medulla is secreting the adrenaline gland and preparing the body for the respective work. Then comes the provide extra energy and strength. Okay, provides extra energy and strength. In excited or angry mode, adrenaline is produced in large amounts. Large amount means in totally means noticeable large amount you can see, because you may have seen that when you are frightened about something, you means start to sweat, that also because of the high secretion of this adrenaline gland. Okay, so the hormones secreted by the adrenal cortex. So many hormones are produced, but the most common is cortisol. Now cortisol can be further divided into mineralocorticoids, glucocorticoids, or sex corticoids, and sex corticoids. So here are the mineralocorticoids. It regulates mineral metabolism like K plus and Na plus ions. K plus means potassium ions and Na plus means sodium ions. Then comes the glucocorticoids. It regulates the carbohydrates, proteins, and fat metabolism. It increases blood glucose level. It stimulates fats and protein stabilization and the metabolism. Okay, it also helps in the salt and water balance in our body. It helps us to adapt to different conditions like in extreme cold condition or in extreme hot condition. That is why people survive in the hot deserts and in the Kashmir areas where it is too cold. And then comes the sex corticoids, which behaves like the sex organs. Okay, behaves like the sex or behaves by sex organs or sex hormones. So overgrowth of the cortex leads to prematurity. Okay, now we are coming to the disease, which is the under secretion of cortisol. So under secretion of cortisol is known as hypocortisolism. Hypocortisolism, it causes the Addison's disease. The patient of Addison disease will have a loss of energy, will have skin pigmentation, weight loss, nausea, that is the urge to vomit, then hypoglycemia, that is hypoglycemia. Hypo means less, glycemia, that means low blood pressure, low blood sugar. Then comes the extreme sensitivity to temperature and susceptible to infections. So on the right hand side you can see all the pictures are some related pictures are given there, you can check it out. Now comes the oversecretion of cortisol. It is known as hypercortisolism. Hypercortisolism. It causes the crashing syndrome. So patient of crashing syndrome will have obesity, hyperglycemia, that is more blood sugar, then osteoporosis, marks on skin, weakness, salt and water retention. On the left hand side you can see the picture. See before, so here you can check it out. Wait, let me show you. So here you can check it out. This person is free from any of the disease like the crashing syndrome, but when he is affected by crashing syndrome, he tends to have more obese. Okay, so this is what it means. Now if we go to the next portion, that is the pancreas. So pancreas is an interesting duct. Okay, why I am calling it duct? Because it is having both the system of ductless glands and the uh, duct glands. Means it acts as a dual gland. It acts as endocrine gland while secreting hormones and exocrine gland while pouring pancreatic juice into duodenum for digestion. It has special hormone secreting cells called islets of Langerhans, which are scattered in the entire pancreas. These cells secrete three hormones from three different cells: insulin from the beta cells, glucagon from the alpha cells, and the somatostatin from delta cells. So insulin, beta, glucagon, alpha, and somatostatin delta. So here is the full picture of the pancreas gland. You can see it out. So here you can check it out. Here are the pancreatic ducts. You can see here the pancreatic ducts. This is the spleen. So this is the pancreas. Basically, this is the pancreas. You can see this whole portion. This you may say it as the gun, like the paper gun that all of all of us have made in our childhood. Okay, that like the paper guns it looks. Okay, almost similar. Okay, so this is the pancreas gland. So there you can see the pancreatic islets. Here are the alpha, beta, and the exocrine acids. And because of the somatostatin is not in our syllabus, as somatostatin is not in our syllabus, just we'll know that from which cell it is being secreted by the pancreas, but we are not going to go into details of it. Okay, now we come to insulin. So insulin is one of the hormone which is secreted by the pancreas gland. It is secreted by beta cells. It checks blood sugar level. How? It promotes glucose utilization by the body, reducing the sugar level. Means whatever it does is that in the body when there is high blood sugar, what it does is tries to control it or lower it. But how? It is means at that time it is promoting the body to use the glucose as much as possible, thus reducing the glucose level. It helps to deposit, and the extra thing after the utilization is deposited in the liver and muscles as glycogen. Okay, the extra blood sugar is uh, deposited in the liver and muscles as glycogen. Now you have to know one thing, one note is there, that is insulin does not convert glucose to glycogen. It only helps the cell to convert the extra glucose to absorb it, use it, or convert it into glycogen. So never ever means have this thinking or have this thought in your mind that insulin is converting the glucose to glycogen. No, it is never, never, never. It only converts the means sorry not to converts, it only helps the cells to convert the extra glucose to absorb it, use it, and convert it. Okay, now the under secretion of insulin and the over secretion of insulin. First we'll see the under secretion of insulin, which is the high blood sugar causes hyperglycemia or diabetes mellitus. Here the mellitus means honey. Diabetic person will have the following syndromes like the following symptoms like the high blood sugar, more urine excretion, ants near the urine, will feel thirsty, loses weight and feel weaker, in extreme can lead to loss of vision. Next comes the treatment. Proper diet with almost no sugar content is needed for the hyperglycemia patient or the diabetic patient, and excess uh, cases means in extreme cases it is needed for the injection of insulin, that is the hormonal injection you need to take. But the precautions you may take like this, that the treatment, if I say it is not a treatment, it is to balance the level so that it does not go too high. Okay, that is why it is I have written that it is a treatment, means ongoing treatment it will go. Proper diet is almost no sugar content. But again, one more thing I would add it here. Okay, let me say it later. Let me complete the oversecretion of insulin, then I am going to say you. So low blood sugar is there, causes hypoglycemia. Patient of hypoglycemia will have dizziness. In extreme condition, the brain may enter coma even if it happens for a few minutes. Even if the blood sugar is very low for a few minutes, the brain may go for the coma. This also for 5 minutes like this it may go. So treatment: taking diet containing carbohydrates and sweet dishes as per requirement. Sometimes a bite of sweet biscuits, sweet candy, or a spoonful of sugar also works. Now, what I want to say is that whether you do the treatment for the or precautions to means control the blood sugar level when it is too high, or when it is for hyperglycemia or for hypoglycemia, you should do it in a limit. Because if suppose you are having diabetes, so any one of your family or any one of your relatives are having the diabetes, so what would happen is that if he or she is not taking any sugar content, so it may happen, it has been seen that sometimes the blood sugar is too low that it results in the hyperglycemia for a few moments. So with a proper diet, now if it is seen that the sugar level, if it is seen that the sugar level is very low, means how you'll know it? So the, as I have told, for the hyperglycemia, so the person may feel something dizziness or something like he or she will feel like he or she is going to fall down only, he cannot see the thing very nicely, means he'll feel dizzy. That time, please please help the person by giving them some sweet dish so that the blood sugar is again controlled. And and one more thing, please take the patient or take the person who is feeling the dizziness and let him or her to sleep for at least half an hour so that the work of the insulin is done and the blood level is again stabilized. Okay, so I would say that if it is over secretion or under secretion, have the precautions, but but have a little sugar amounts you may have, but if you are having extreme, so better to avoid it for at least the first 6 months. Okay, at least the first 6 months don't take it. After that you can take in a week one sweet you can take. Okay, that's small sweet, not the big rasgullas you will take the small sweets, small amount of sweets you can take, so that the blood level is not too much low or not too much high. Also don't take the sweets for I am saying it for the hypoglycemia patient now. So if you are taking too much of carbohydrates, too much of sweet dishes, you will again result to hyperglycemia. Okay, so try to have a balance in the food items, try to have all the food items but limited amount. Okay, so sweet dish for the uh, diabetic patient, I will say that if it is too high, don't take it for at least the first 6 months, then take small amounts, only small amounts you may take, so that there is no imbalance in the blood sugar level. The similar thing for insulin, sorry, for the over secretion of insulin person, like the hypoglycemia person, that try to take the diet that the carbohydrate and sweet is as per the requirement. So I have mentioned it here as per the requirement, because if you are taking too much, so it will again result to another disease. Better to have a control on it. Okay, now we'll come to glucagon. Okay, now it is secreted by alpha cells. Glycogen in liver is converted to glucose and raises blood sugar in the level. Okay, now with contest to this, let me say you one thing. When there is under secretion of insulin, when there is under secretion of insulin, there is a diabetic patient. Is the person suffers from diabetes, and when there is over secretion, the patient suffers from hypoglycemia. That is clear to you all, I know. But the thing comes here is that when there is under secretion, so the glycogen level is too high, and when there is over secretion, so the insulin level is too high. You can relate it. So you know that for diabetic patient, the blood sugar is too high, means you have to avoid the sweets, so that the insulin level is means on the same level of the uh, glycogen. And when it is over secretion, so you know that you have to take the glycogen, means not in that sense glycogen you cannot take it directly, means glycogen increasing or stimulating foods, you may say, if I may say so, glycogen stimulating foods you need to take, like the carbohydrates and the sweet dishes. Now there may be a question that suppose like this one question is given, which which hormones increases the blood level, blood sugar level. So you will say that glycogen increases the blood sugar level, which decreases the blood sugar level, insulin. Okay, so here you can see one chart, that is the from when there is blood, let's start from the right hand side, low blood sugar. So when there is low blood sugar, so obviously it is promoting the glycogen release through the alpha cells. Okay, so then glycogen will be there, so glycogen will be converted to glucose by the glucagon hormone. Now when there is low blood sugar, to lower the blood sugar, okay, to lower the blood sugar means when there is high blood sugar, to lower it, insulin is used. So this chart you may have a screenshot of it and you can take it up, and you can learn it from here also. Now comes to thyroid gland. It is a bilobed and butterfly shaped structured gland. It is situated in front of the neck just below the larynx. Now two lobes connected by a narrow isthmus. Hormones secreted are thyroxine and calcitonin. Hormones which are secreted are the thyroxine and the calcitonin. The picture you can see on the right hand side. So in the thyroid gland only, if you see the back side of the thyroid gland, here the back view, if you see this back view, if you see back view, so you can see the parathyroid glands. So these glands, okay, these glands, these bean shaped glands on the corners of the thyroid glands. So these are the parathyroid glands. The thyroxine. It regulates the basal metabolism, plays vital roles in regulating the body's metabolic rate, heart and digestive functions, muscle control, brain development, and maintenance of bones. Okay, very nice, done. Calcitonin is not in syllabus, still you need to know a bit about it. That is opposite to parathyroid gland, because parathyroid gland increases the calcium level. Okay, parathyroid gland increases the calcium level and calcitonin decreases it. Because excess of anything is never good to our health, not to any of the matter in the world. Okay, so if there is high plus calcium level, so calcium is decreasing it. If it is low, so parathyroid gland is increasing it. Simple thing, and nothing else is there for calcitonin. These 2 points I have just given. For if anyone of you want to know about it, you may see it from me. But the main basic thing is that parathyroid gland increases the calcium level when there is high calcium in our blood, so calcitonin just decreases it. Just the same as, means very simple thing. Calcitonin decreases the calcium level. Parathyroid gland increases the calcium level. Simple, simple, simple. Now we'll go to the undersecretion of thyroxine or hypothyroidism. It leads to simple goiter, which is due to the which is seen by the enlargement of the gland and visible as the swelling of neck. Okay, which is due to the enlargement of the gland and visible as the swelling of the neck. Then comes the cretinism, which is due to defective development or early generation of the gland. It affects growth of children, dwarfism, and mental retardation. And then comes myxedema, which is malfunctioning of the gland, sluggish with swelling of face and hands. So goiter you can check it here. So goiter you can check it here. That is all because of the swelling of the neck. It is visible, and it is because of the enlargement of the neck, means the gland. Here the gland. So this is the goiter. This is the myxedema. You can see the sluggish face and swelling face of hands. Yes, sluggish face means it is looking like it is always swelled up. This is the cretinism. Okay, this is cretinism. This is myxedema. This is cretinism. So there is a degeneration, or it is affecting the growth of children. Now we'll come to oversecretion of thyroxine, that is the hyperthyroidism, and it leads to exophthalmic goiter. Exophthalmic goiter. It increases the metabolic rate. It is also leading to the rapid heartbeat, protruded eyes, and goiter. So increasing metabolic rate and rapid heartbeat, you cannot see it. It is only felt by the uh, patient of exophthalmic goiter, and the doctor can understand, or the person is in means who are checking up or who are with this person, okay, with this patient of exophthalmic goiter, can understand it. Because if they are putting the hand on the heart, you can see on the chest region, so they can see that it is means the beat is very rapid. Okay, the beat is very rapid, the pulse rate also increasing. This may happen. But the protruded eyes and goiter, you can see that is visible. So protruded eyes means this one. Protruded eyes means this one. As you can see, I will always say protruded eyes means this one. Okay, protruded eyes means the eyes seem to come out. The eyes seem to come out of the socket. You know the socket, that is the optic socket. Okay. So now if we talk about that treatment for both hypothyroidism and hyperthyroidism, so the treatment is that it depends on the seriousness of the disorder. The preventive method is to take adequate, that is neither less nor more amount of iodine, rich rich food like dairy products, green vegetables, etc. So the first one is that it depends on the seriousness, and if it is not too serious, that means this hyperthyroidism and hypothyroidism is having many stages. Like in the initial stages, I think we have all known to some persons, or maybe in your family only someone is taking the thyroid medicines. Yeah, thyroid medicines that you should take in the morning. So that is the initial stage. If someone understands that one, so that time the preventive method is to take the adequate, means the preventive method of having the goiter or the cretinism or the myxedema or the excess goiter is that to take the adequate amount of iron rich food like the dairy products, green vegetables, etc. Now you go to the pituitary gland. It is the master gland. It is a small bilobe projection hanging from the base of the hypothalamus. It is about the size of a pea. It weighs about 1.5 gram. The master gland, as it controls the other endocrine glands. The lobes are anterior pituitary and the posterior pituitary. The front part of the posterior pituitary is a bit different from the lobe. It is known as the intermediate lobe, which is absent in humans but larger in some animals. Okay, so this is also one important point to note. Okay, next. So here is the full picture. So here you can see the pituitary gland. It is hanging out from the hypothalamus. So it is the anterior pituitary, and this is the posterior pituitary. Okay, so here it is the in last picture you can see there, and here it is showing with the brain structure that where it is exactly present. This is the inlet structure, and this is the structure, means it is showing the main location. Okay, so now, so these are the hormones which are being secreted by the anterior pituitary and the posterior pituitary. Let me see. Now we will start from the posterior pituitary. Posterior pituitary is first doing the or first secreting the hormone, that is ADH, antidiuretic hormone or vasopressin. Antidiuretic hormone or vasopressin directs the kidney to absorb water from urine, maintains the water level in the body. Then comes the oxytocin, which is helping in two things. First, it is the stimulating the breast milk to means to contract and relax during the breastfeeding of the baby. Next comes that it is also this oxytocin is also helping in the construction of the uterus during the pushing of baby from the womb. Okay, next comes the nothing comes next from the anterior from the posterior pituitary. So this is the last thing. Okay, that is two hormones we have seen, that is the ADH and oxytocin. Important one we have seen. Okay, if there is any other, you can just refer to it also. But the important two are the ADH and oxytocin. Now if we come to the anterior pituitary, so posterior pituitary have done, now you will come to the anterior pituitary. So it is first giving us TSH or thyroid stimulating hormone. It is helping in the stimulation of the thyroxine hormone. Then comes ATCH, that is adrenocorticotropic hormone. So it is also helping the adrenal glands to stimulate it, and in turn helping us to face any situation. Next comes the PRL, prolactin. PRL, prolactin. It stimulates the milk production in post pregnancy. That is, it stimulates the mammary glands in females to produce the milk that is being fed to the baby after the birth of the baby. So during the pregnancy or during the post pregnancy, after the pregnancy, for a time, during the pregnancy period, at the last month of the pregnancy or after the pregnancy, this prolactin is stimulating the mammary glands to produce the milk. Next comes the MSH or melanocyte stimulating hormone. It is stimulating the skin cells and producing the melanin, which is the skin pigmentation. Next comes the GH or growth hormone. So it is also known as somatotropin. Okay, it is also known as somatotropin. Stimulates the growth in bones, making the body grow larger. Now there is one more thing to know here. If there is uh, excess of growth hormone, it leads to gigantism, and if it is deficiency, it leads to dwarfism. Okay, deficiency means dwarfism and excess means gigantism. Now one more thing is there, that if this gigantism is happening in the elders, suppose up to up age it was okay, but at the means at the age of suppose 20 to 30, suddenly the growth hormone has increased, which will lead to acromegaly. Okay, acromegaly. Understand it? So acromegaly will again result in the thickening of the leaves or the nose. This one. Next, The last two are the FSH and the LH. FSH and LH. FSH means follicle stimulating hormone, and LH means luteinizing hormone. So they both uh, contribute in the stimulating of the sex hormones. Okay, in the stimulating of the sex hormones, and during the sexual development in the adolescent stage. Now you come to the feedback mechanism. It is too much, so slow down; too little, so speed up. Means that when there is high amount of hormone, so the feedback is that please slow down the secretion, and when it's too little, then you say speed up the secretion to balance the hormone. Now there are two types of feedback, that is the negative feedback and positive feedback. First we'll see the negative feedback, which is opposite messages or command. Like if the blood sugar is low, if blood sugar is low, so glycogen to increase and vice versa. So glycogen is increasing it and insulin is decreasing it. Glycogen increase, insulin decrease. So this is negative feedback. Positive feedback is very less in our body, but it happens. It happens when there is same message as command to the body. It happens when during the contraction of uterus till the delivery. When there is contraction in the uterus, so normally we say that if there is high contraction, so is to say that to relax. But this is a situation when the pituitary gland or the master gland commands to have more and more contraction in the uterus so that the baby is taken out from the womb till the delivery. Okay, then gradually again it relax. But during the delivery, all the all the muscles in the uterus are contracted, and this is the positive feedback. It's same message: contract, 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 and contract. So positive feedback. If it is saying contract, no. If it is highly contracted, so relax. Highly relaxed to contract. This is a negative one. But you have to know the example. Like this example, you can give for the negative feedback, and this is one of the important, or you may say, this is one of the very, you may say, very rare example of positive feedback. Okay, very rare. Positive feedback is very rare. So it is an example. Okay, so we have ended up with it. So now all I would now say you to be serious with your studies. Try to learn the topics very nicely and try to clear your doubts. So once more, I would like to thank you all for this, for watching this. So thank you and have a nice day. Bye.